turn demonstration on the assessment of jugular venous pressure, or the JVP, one of the most essential components of the cardiovascular examination. So what really is JVP assessment? Jugular venous pressure assessment is more than simply observing a vein in the neck. It is a powerful, non-invasive bedside technique that reflects the pressure in the right atrium of the heart. Through this assessment, nurses can evaluate fluid status, detect signs of right-sided heart failure, and identify cardiovascular compromise early. As future nurses, mastering this skill strengthens our clinical reasoning, sharpens our observation skills, and enhances patient safety. So, let us now proceed to the demonstration.
Good day,
Step
sir.
number 1, hand hygiene and introduction.
May I know your name and birth date?
Kinandre Amarado, July 30, 2007.
Okay, so sir, I'll be checking your jugular venous pressure today. So, to check for any heart function. So, may I have your consent to continue this assessment? Okay, but first I'll just do my hand hygiene here. Okay, all done?
Hand hygiene prevents cross-contamination and ensures patient safety. Introducing oneself and explaining the procedure promotes trust, reduces anxiety, and improves cooperation, all of which are essential for accurate assessment.
Step number 2, proper positioning, 30 to 45 degrees. Adjust patient to semi-Fowler's position.
Sir, can you lay comfortably and allow me to raise the head of the bed about 30 to 45 degrees?
Notice how positioning is precise and intentional. In nursing assessment, even small adjustment can influence diagnostic accuracy.
Okay, good.
The 30 to 45 degree angle is critical for accurate visualization. If the patient lies flat, the jugular vein may appear descended and falsely elevated. If too upright, the vein may collapse and be difficult to see. This position allows the highest point of venous pulsation to be observed correctly.
Step 3. Turn the head slightly.
Sir, can you move your head slightly to the left? Okay. Then move here. Do you feel comfortable with that? Okay.
The head is turned slightly to relax the sternocleidomastoid muscle. Excessive turning is avoided because it may compress the vein. The right internal jugular vein is preferred because it has a more direct anatomical pathway to the right atrium, providing a more accurate reflection of central venous pressure.
Step 4. Use tangential lighting.
So now, sir, I'll be using the tangential lighting to better observe for your position.
Jugular venous pulsations are subtle and undulating. Tangential lighting creates shadows that enhance visibility, allowing the nurse to differentiate venous pulsations from arterial pulsations. Step 5. Identify the internal jugular pulse.
Now I'll be observing the highest point of the venous pulsation. Okay, here.
It is important to distinguish the jugular venous pulse from the carotid pulse. The jugular venous pulse is not palpable, has a soft wave-like motion, has 2 peaks per cardiac cycle, changes with respiration, and decreases when the patient sits upright. The carotid pulse, on the other hand, is palpable, has a single brisk upstroke, and does not vary with position. Correct identification ensures measurement accuracy.
Step 6. Measure the JVP.
Now that we're done locating the highest point of the venous position, we're going to proceed to measuring the jugular venous pressure. Okay.
The sternal angle is a constant anatomical landmark and is approximately 5 centimeters above the right atrium. Normally, the vertical height of the jugular venous pulsation should be 3 centimeters or less above the sternal angle. When 5 centimeters are added, the total central venous pressure should not exceed 8 centimeters of water, which is considered normal.
Step 7. Interpretation.
Sir, we're all done for our assessment, so you can now sit comfortably. So allow me to help you. So sir, good news. After measuring your jugular venous pressure, as you can see, the results appears within normal limits, which is 3 centimeters. So all good, sir. So you can now go. Thank you.
An elevated GVP may indicate right-sided heart failure, fluid volume overload, pulmonary hypertension, constrictive pericarditis, and cardiac tamponade. Elevated GVP often correlates with peripheral edema, ascites, and hepatomegaly. A low or absent GVP may suggest hypovolemia or dehydration. Therefore, GVP assessments guides nursing interventions such as monitoring fluid balance, evaluating response to diuretics, and assessing cardiac function.
And that concludes our comprehensive demonstration of jugular venous pressure assessment. Today, we learned that JVP is not merely about observing neck veins. It is about understanding cardiac physiology, applying critical thinking, and ensuring accurate clinical judgment. Through proper positioning, correct identification, precise measurement, and informed interpretation, nurses transform a simple bedside observation into a powerful diagnostic tool. So, as future healthcare professionals, may we continue to refine our skills, deepen our knowledge, and approach every patient assessment with precision, compassion, and critical thinking. Thank you for watching.